Hello everyone, this is Gautam from Shailaja IS. In this video, we'll be discussing on the recent event of US officially withdrawing from World Health Organization. Actually, US was at the forefront of establishment of World Health Organization in 1948, and it has come a full circle where now it has been officially withdrawn from the international organization itself. To look into the timeline part of it, when this process of withdrawal started, I think it goes back to 2020. 2019 was your COVID-19 pandemic. In June 2020, then US President Donald Trump sent a notification that US wants to officially withdraw from the World Health Organization. And the waiting period for US withdrawing from WHO was 1 year. So officially it was supposed to withdraw on 2021 of July. But what happens? There was a change of presidency in 2021, and your new president Joe Biden, when he assumed the office of US presidency, the first day he withdrew that, he retracted the withdrawal. He said that we are going to continue to be a part of World Health Organization. So whatever was the withdrawal process initiated by Donald Trump was taken back by the then president Joe Biden in 2021. Now Joe Biden finished his presidency in 2025. Again, your Donald Trump became the president of USA. And on the very first day, again in 2025, January 22, the first day on assuming the office, he signs an executive order saying that I want to now officially withdraw from the World Health Organization, and it gave 1 year notice. That is the rules of this organization. 1 year has passed, so officially in January 22, 2026, US has now officially withdrawn from World Health Organization. So that is the story or the timeline of it. Now, this timeline is not really important. Now, what is important for us, for an UPSC civil service aspirant, is to understand the implications of USA withdrawal from World Health Organizations. Right. So before we understand the implications of it, we'll try and first understand what is the significance of World Health Organization, and we'll try and understand what are the reasons that US has officially given in order to withdraw from the World Health Organization. Right. So let's start with the first part, that is your origin and significance of World Health Organization. If you can look at the history, we can trace its origin in the mid-19th century, where countries in the European continent wanted to coordinate amongst themselves in order to tackle with the spread of diseases like cholera, because it was spreading across the border, and they felt in order to control this disease, we need to have some sort of a cooperation or coordination amongst different countries. So they established something called as International Sanitary Regulations in mid-19th century. Then in 1907, an official international office of sanitation was established in Paris. And after your World War I, your League of Nations was, you can say, established. And as a part of League of Nations, there was something called as Health Organizations of League of Nations. Okay, so that tried to somehow bring countries together in one platform in order to coordinate and in order to take certain measures for the overall public well-being. Right. And but the League of Nations itself was a failure. It could not fulfill the mandate in which it was established for multiple reasons because of the internal politics. Right. So we'll not go into that world history part of it. So we'll just try and understand the evolution of your World Health Organization. And finally, in 1948, your World Health Organization was established as a specialized agency of United Nations. Okay, and it had its own constitution, and very first time the World Health Organization clearly stated that health is a fundamental right of any person. Okay, so it clearly defined what is health. It not merely stated that absence of disease is health. No, it clearly stated your health involves, or the definition of health is the well-being not only of physical state, but also mental state and social state. So it clearly stated that health is not absence of disease, but physical mental and social well-being of an individual. And it has clearly enunciated in the constitution of the World Health Organization that health is considered as a fundamental right. It cannot be taken away from the person, right? And one of the important functions that it performs is about standard setting. Now, what do you mean by standard setting? The first thing is international classification of diseases. See, there has to be some common language across 190 plus countries in order to report and monitor the outbreak of diseases. So whatever is identified as disease A in country 1 should be identified as the same disease A in country 2 or others. Okay, so there needs to be a common language for the nations to report diseases and to monitor the diseases. That's the very first standard that it is setting. So it provides a list called as International Classification of Diseases, and all the countries across the world follow this particular classification, right? Next, it also provides international health regulations. Okay, so one of the important aspect of these regulations is if there is outbreak of any disease in that country has to immediately report to the World Health Organization, because disease in the present globalized world is not only limited to one country, it can spread to other countries as well. And that is the reason the World Health Organization believes for effective monitoring and effective coordination, countries has to first report the outbreak of diseases. That is one of the regulations that it has put in place amongst many others, right? And finally, it provides a pre-qualification of medicines. Okay, so whatever is the vaccines that is used across the world for your smallpox, for your measles, pneumonia, all multiple vaccines, first ideally it needs to be pre-qualified by the World Health Organization. Once World Health Organization gives a stamp of approval, only then the other countries or other aid agencies are going to procure that particular medicines and going to distribute in order to control the diseases. Right? So these two are very important functions. We'll come to this part of it, the international reporting part of it, of any disease outbreaks, and also the qualification of medicines, again in the coming part of the video. Right? Another important aspect which the World Health Organization does is it is directly involved in the disease eradication and control of multiple diseases. One of its successful example is that it has eliminated or eradicated smallpox across the world in 1920. And it was primarily because of 3 decades of coordinated efforts by World Health Organization and its staff that they were able to eradicate this disease itself. So in that endeavor, World Health Organization is trying to control the spread of other diseases also. It is trying to eliminate or eradicate the spread of other diseases also, like your malaria, tuberculosis, HIV, AIDS, Ebola, etc. Okay, so there are multiple initiatives and programs which has been carried out by World Health Organization, especially in your vulnerable regions or high impact regions, where they are trying to provide some sort of an awareness, medicines, training in order to control or eliminate these diseases itself. Okay. Another important role which the World Health Organization does is your emergency response. Okay, it gives out a bulletin with regard to your public health emergency of international concern, which is the highest alert level whenever there is a spread of diseases. For example, what we witnessed in 2019, the COVID-19 pandemic, it had its origin in Wuhan province of China, but it soon spread all across the world, right? And WHO within certain time, it said that we are now it is now a public health concern of public health emergency of international concern. See, there might be Zika virus outbreak in parts of Kerala, there might be monkey fever disease in parts of Karnataka, but these are not considered or not elevated as public health emergency of international concern because the spread of those diseases is not very huge. So WHO, whenever it says that, okay, it's now a public health emergency of international concerns, it is going to push countries to mobilize resources so as to take a coordinated efforts to bring this epidemic or pandemic under control. Okay, so that's the emergency response part of it. WHO plays a very, very significant role. I think what you have witnessed in 2019, COVID-19, when there was this pandemic, which started in China but spread all across the world. And WHO was at the forefront in order to coordinate the global efforts with regard to formulation of vaccines, with regard to distribution of vaccines, with regard to sharing of data. And so it is, if not for World Health Organization, our entire world would not have dealt with the COVID-19 pandemic in such a fast, quick manner, right? So we need such type of international organization in order to deal with diseases which does not see any national boundaries. These can spread easily across the world, right? And finally, it is going to help with regard to your research and data purposes. For example, whatever was the research that was undertaken by different countries during COVID-19 pandemic with regard to identifying the molecular structure of your virus, trying to understand which method to be adopted, what approach needs to be adopted to develop vaccines, all this was shared across the world so that humanity as a collective manner is pushed towards resolving this issue in a quick manner, right? And it's also involved with capacity building with regard to training of health staff in order to deal with certain emergencies, in order to deal with certain diseases, right? And most significantly, in 2025, a pandemic agreement was signed, which is a legally binding agreement, which provides for equitable access to pathogen access and benefit sharing. So basically what it says is that if the countries are a part of this agreement, and if they share whatever is the research data on the viruses or other pathogens, they will be then eligible in order to get access to the vaccines which might be developed in any part of the world. Okay, so they will be rightfully entitled to get access to those vaccines in an affordable manner. That is this pandemic agreement. Why it was signed? Primarily because the experience showed that rich countries were, you can say, hoarding or keeping huge stocks of vaccines, whereas poorer countries were not in a position to buy these vaccines from the open market and the prices were very high. So for equitable access, for fair distribution of such type of essential resources, life-saving resources, this agreement was signed so that in the future, this type of mistakes will not be repeated. So the agreement clearly says, okay, if you are providing pathogen access and benefit sharing, so you are going to get access to the research data on the pathogens. If you do that, you will be sharing the benefits of whatever is the outcome of that research or data, right? That's a separate topic in itself. We'll not go deeper into it. But I think this essence of it, if you are able to understand, that is enough. Okay, so that is the overall part of your World Health Organization, its origin and its significance aspect of it. Now, coming to the reasons as to why USA said that I want to withdraw from the organization, from the very organization which it actually established in 1948. Now, one primary reason which Donald Trump in 2020 stated, and he repeated the same thing in 2025, was that he alleged that World Health Organization did not handle the COVID-19 pandemic in an effective manner. Okay, it's one of the criticisms of World Health Organization by the USA was that you were acting in a politicized manner. You are not forefront or you are not transparent with regard to declaration of public health emergency. You were under the pressure of China in order to not declare certain data or research findings with regard to COVID-19 pandemic. Okay, so it said that there is a perceived lack of independence. So it is under the control of your China. The Director General of World Health Organization said that he was acting under the pressure of China. That allegation was made by USA. Okay, and USA also stated that it failed to reform. Okay, even after making all those allegations, accusations, even after saying that they are not transparent in its functioning, USA further said that despite this, you are not trying to rectify, you are not trying to reform. Okay, so that is the primary argument. So you don't know if it's really true or not, because World Health Organization, the major donor or the primary political power of this organization, used to rest with USA. Okay, because USA was the largest donor of World Health Organization, and that was also one of the arguments given by Donald Trump. Okay, he said that there is a disproportionate financial burden on USA, which contributes $700 million every year. And it said that there are other well-to-do countries, but they're not contributing effectively to the World Health Organization, primarily pointing fingers to China and India and other European countries. They say that I am contributing too much, but these countries are also equally having good resources, but they're not contributing much, right? And there was also a different worldview of Donald Trump, who was not believing in multilateralism. He was not believing in all those international organizations. He basically said that whatever is going to be the aid or support that I'm going to give for other developing countries or least developed countries, I'll do it directly. Let there be a bilateral agreements, let there be a bilateral support. I'm not going to make use of all these multilateral platforms. So that was his politics itself, that was his political view itself. And that is also one of the reason which was given by USA for withdrawing from World Health Organization. So bilateral health agreements, I'm going to do direct country to country support. I don't need World Health Organization to provide support to African countries. I'll do it directly. That is what is the argument given by USA. See, if these reasons are valid or not, we don't know. There are counter arguments which says that it is not really the case, that the World Health Organization was acting under the pressure of China, or it did not declare the COVID-19 pandemic as the public health emergency of international concern soon enough. It is not like that. But it's all conspiracy theories. So there were conspiracy theories which was floating that China intentionally released this virus to the world. But there is a counter argument which says that China knew about the outbreak of these diseases, but it did not report it immediately to the World Health Organization. If it had reported much earlier, it could have controlled within the China borders itself and it could not have spread to other countries. So there are all these arguments, counter arguments, but nothing conclusive has come out of any research or reports of any credible international organizations. But we'll not go detail into all those conspiracy theories. We'll try and understand what are the basic arguments given by USA for withdrawing from World Health Organization. Okay. Now, what is going to be the implications of this withdrawal? If suppose US is withdrawing, what is going to happen? The first and foremost thing is that the biggest funder is now not there. Okay, it used to contribute $700 million every year, close to 30% of it. And that source of funding is drying up. When your source of funding is drying up, what happens? Your organizational activities which you used to take down, you are going to reduce the number of programs, you are going to cut down your staff. So that is what organizationally it is going to be impacted because of the financial blow. Now, in order to deal with this blow, there is only other option left, that other countries have to plug all this gap, right? Second important thing, because of reduced staff level, because of reduced programs, your disease surveillance is also going to get weakened, because US was a critical part of the WHO's early warning network. Okay. US was having its multiple laboratories, multiple research stations, which used to monitor, or which was an integral part of early warning systems. And since US is withdrawing from it, there is going to be a huge gap which needs to be filled. The impact is that your disease surveillance itself, you will not be knowing what is happening where. That itself is going to get weakened, right? Now, since US is withdrawing on the allegation that China is influencing the organization, the gap which has been left by USA is going to be further filled by China. So there is a geopolitical impact as well, where there is a high possibility that China is going to occupy the space vacated by USA, and it is going to further take control of World Health Organization, right? Another important aspect is your developing nations are hit the hardest. Your countries in your Africa, your countries in your South America, who are actually in need of all this aid and support by World Health Organization, be it with regard to provisions of medical aid, medical supplies, disease surveillance, training of staff, all this will be impacted because your funding is drying up. So you have to inevitably scale back your staff and programs. So the developing countries is going to be hit the hardest. Developed countries will have the resources, they will manage their own health programs, right? It is the developing countries which is going to be hit the hardest. Okay, your scientific collaborations is going to be disrupted because all your US's national, some of the national laboratories, they have been given the directions that the researchers should not collaborate or should not continue to collaborate or share data with the World Health Organization. Okay, so that collaboration is now going to be disrupted, and it's going to have a drastic impact on the overall collective efforts of humanity in order to control the spread of diseases, right? And finally, if all this is happening, if at all there is going to be another pandemic in the coming decades, the capability to respond to it in a more effective manner is going to be weakened because the critical player himself is not there, funding is not there, programs are going to be scaled back, research data is going to be disrupted, collaboration is going to be disrupted. So as a result, overall, if there is an emergency maybe in the next year, in another 2028, obviously it's going to be the overall response as a collective global response is going to be weakened because the major player himself is not there. Okay, so that is all about this issue. I hope you got the essence or crisp of it. There's one question: withdrawal of USA from World Health Organization marks a shift from multilateralism to health nationalism. Okay, critically analyze the implications of this move on global health architecture. Okay, so they are just asking you what are the positives of it, what are the negatives of it, right? I think with all the points that I have discussed, you will be in a position to write an answer for a 10-marker question like this. Okay, so if at all you are attempting this question, you can always send it to my email ID, or you can share it to my on WhatsApp or Telegram. Okay? Below is this is my number, this is my email ID. Looking forward for your responses. Thank you.